So my name is Yesireth Solis, and I'm going to be talking about healthcare systems around the world, focusing on Spain, which is where I did my internship in, and specifically answering the question of what constitutes as a good or perfect healthcare system, and whether it's effective and whether it can be executed properly, in my endeavor of becoming a better physician myself. Okay. So this summer I interned with Civic, which is the Centro Internacional de Estudios Culturales. And it's a program through the University of Richmond that offers students the opportunity to immerse in the Spaniard culture, both looking at the lens of historical significance of the city in Sevilla, as well as the academics, and also offering the healthcare aspect of Sevilla, which is what I was in. I was placed in a weekly rotation, shadowing at 3 different sites, 3 different doctors, both in the field of pediatrics. And the reason why I chose Sevilla was because the capital city of Andalusia is known to be the best healthcare system in the world as of now. And as someone who is working or thinking of working with Doctors Without Borders in the future, it would be a great benefit for me to improve my communication skills in many different countries, specifically in Spanish-speaking countries, and improve and build on my medical terminology in this language. And going into Spain's healthcare system, just a little background of what it constitutes. It was reformed in 1986 under the General Healthcare Act. And some of the major points of their healthcare system is that there's universal coverage with free access to healthcare. There's public financing through taxation that makes universal coverage possible. And there's a new model of primary healthcare promotion, prevention, and rehabilitation that focuses heavily on primary care in their sector, and the integration of different health service networks in their system. And this is all done and overseen through 3 different organizational levels. And I was in the local areas of health, is what they call it, áreas de salud, interning in these 3 different sites. And I'm going to focus on universal coverage with free access, and as well as the focus on primary care within the 3 sites I interned. And this has to do by looking at who has access to healthcare, how is it possible to make healthcare accessible for those underrepresented in their country or whatever, in any country in the world. And the first place I interned in was Villamed Hospital Santa Ángela de la Cruz. And Villamed is actually a private hospital composed of a team of specialized pediatricians focused on both the consultation aspect of healthcare as well as the hospital emergency ER aspect. And I was specifically placed in the consult under Dr. Fernando Ferreira and many of his different colleagues that worked for him. And in this site, I really got to experience the primary care that each one of these doctors places on their patients, the general protocol of a child and their growth development, how during every single consult that I was in under his supervision, even if the kid was sick, even if they went for a medical diagnosis, even if it was just a regular checkup, he would make sure and ensure that each one of his patients and the parents were following the general protocol of their dietary plan, the dietary restrictions, solar protection, and many of the little small details that come into account of primary care of a child's development. And that's something very important that I saw within him, as well as other colleagues, as well as many different other areas and specializations and doctors within this facility. And to move on, that's Dr. Fernando Ferreira. One of the quotes and statements he mentioned that really resonated with me is that after being with him from 9 a.m. to 9 p.m. in his consult, seeing patient after patient, he turned to me and told me that that's the reason why he does the pediatrics. He is in pediatrics because he loves the work he does. He dedicates so much to it, and it was shown in his actions, in his way of interacting with his patients. Everyone loved him. Everyone was confident in him, trusted him. And this is one of the aspects of primary care that doctors focus on, especially in this facility, that I noticed that made primary care such an important aspect of every single one of the family's lives. And the second site I interned in was Hospital Fatima under Jorge Lecomte, and he was a gynecologist, and he also focused on primary care, not only in this case based on the soon-to-be mother side, before in the prenatal, neonatal care. And I really got to see how he was following up with his checkups. He would not only consider the medical diagnosis or the medical problems that each of his patients were coming to him with, but also looking at their relationships. How was the dynamic between their relationships and between their partners? And he was taking into consideration many different factors that maybe many other doctors don't take into account. There are many other factors that may influence their medical diagnosis, may influence the reason why they're there in the first place. And this was a life-changing experience, at least for me. This is Dr. Jorge Lecomte, because I got to experience my first ever live birth. And it was such a life-changing experience. I remember him telling me after everything happened, we were actually during a consult, and there was a soon-to-be mother. We were talking to her, and then he got a phone call, and they said, one of your patients is giving birth right now. And so he was like, wait, right now? And then he said, well, I gotta go now. So then he left the patient we were with for a moment. He said, I'll be back. And we ran to the room where she was giving birth, and everything was quick. There were no complications, gratefully. And after that, he turned to me and said, what do you think? Thinking that I was traumatized, that I would never want to go into gynecology again. But for me, it was such a life-changing experience. It just reinforced my confidence and my goal of becoming a pediatrician and maybe a gynecologist in the future. And hopefully not the first of many. And the last site I interned in was Hospital Quirón Salud Sagrado Corazón in the OR, as well as the Instituto Hispalense de Pediatría, or also known as IHP, during consultation. This was under many different doctors because there was a team of OR doctors, and then once it came to consults, I was mainly with Dr. Downey and Dr. Salas. And with this one, I thought it was the most impacting, at least for me, because I got to see the universal coverage of healthcare in place in his private practice. And he mentioned one day that because he had a monopoly over a certain procedure he had the ability to do and perform, he could put the price of that medical procedure at whatever he wanted. He gave a number of around $62,000, and he said, I can give this medical procedure, I can charge this medical procedure for this amount. But if there was someone else around the world who was now able to perform that medical procedure at a lower price, and he felt obligated to lower the price. Not enough to the price that maybe the other physician would give it to, but just enough where he would gain profit. And that was really shocking, at least to me, because it was not only him trying to help patients, trying to help those seeking for the medical procedure, but also for his benefit. And at least it all comes down to whether you take into consideration the family's the family situation at the moment. And that medical procedure that he had mentioned was with a family who was seeking his skills, specifically him, because he was known to be one of the best doctors. And they were trying to have their public insurance pay for half of it or the majority of it, or whatever they can cover with it, and then have the family pay the remaining. And what he had told them is, you can't do that. You have to pay in full with your money or I won't do the procedure. And that was really shocking, at least to me, because even though he wanted to help the family, it was impossible for him because it was his private practice and he was the one charging for this procedure. And after interning in all these 3 sites and shadowing these 3 doctors, I came to realize that even though Spain's healthcare system is known to be one of the best, it all comes down to how it's being executed by the different doctors and physicians in in any hospital, in any clinic, because they have the ability to change this. They have the ability to give the opportunity and access to healthcare to anyone they want to. And just to end this, a special thanks to the Bonner Center for Civic Engagement, who gave me the opportunity to go abroad and experience this, and Dr. Rick Mace, who was just an amazing mentor and support during my journey, and everyone else who supported me and gave me emotional support. And thank you.